Hey everyone, it's Dr. Chris with Texas Chiro Health, back with your 12 minutes to health. Little different 12 minutes to health this time. I didn't really put together a PowerPoint, just kind of woke up this morning and started doing some research, and I've taken some notes on some stuff I found, but it all kind of stemmed from a conversation that I was having last night while I was out to dinner. The waiter and I got to talking. He's a friend of mine I've known for a long time, and he was asking me about the vaccine and what kind of questions I was getting and what the research says. And as you guys know, on these 12 minutes to health, I do my best every week to find the randomized controlled trials, right? The real studies that are out there that show us how to live a healthier lifestyle. And I typically base that around, eating better, getting more exercise. What's the research say about how much we're exercising and what that does for us, what we're putting into our body, what that does for us, and managing our stress. And those are typically the three topics I hit. But his one comment that he made yesterday made me want to dig into the vaccine research and see what's going on. He was asking me about immunity provided by a vaccine versus immunity coming naturally from the infection with the COVID virus is what we're talking about in this instance. And I said, well, just, from a common sense standpoint, nothing's going to beat natural immunity. I mean, we haven't found a way to beat natural immunity yet, right? An example would be the chickenpox. There is a chickenpox vaccine, sure. But if you recall, when I was a young kid and when most of us were young kids, we actually had chickenpox parties at one time, right? So we could get infected with chickenpox because we knew we would get through it, we knew our immune system would fight it, and then we would be immune to it. And he was asking me, does that kind of natural immunity exist? And I said, well, there's some studies that point in that direction, but like I've been saying for a long time, it's too early to tell. We don't have the long-term data, we don't have the long-term research yet. And it'll come, but it's gonna take time. Like I've been saying, this is years down the road before we get real answers to this. And so I just picked up my phone, and I got on my Google Scholar so I could get to the peer-reviewed medical journals, and I found a couple of research articles for him. He said, I get that, but watch this. And he typed the same thing that I typed into Google Scholar to get real research, he typed into just regular Google. And the first 10 articles that came up were about how natural immunity doesn't exist, and the vaccine is outperforming natural immunity. And you had to scroll way down to get to the articles that I was finding first on Google Scholar, which is research-based. So it's it kind of made me want to do this talk and just talk to you guys about what I've found, because there's a lot of misinformation out there, and and I call it misinformation because we don't know just yet. But there have been some studies done, right? Not the randomized controlled trials that we're looking for. Those don't exist with this vaccine yet. It takes too much time, and we had to push this vaccine through in an emergency use authorization, right? So the FDA approved it for an emergency. One of the things with the emergency use, though, is that we're supposed to not have a viable treatment for the disease that we're pushing an emergency use for. In this case, we do have viable treatments, and that research is clear out there that ivermectin is very effective against fighting this virus, stopping the replication of it, reducing the symptoms, and getting people better. So you start to question, why did we push this emergency use? Why are we ignoring the data that does exist on ivermectin, on monoclonal antibodies, on the treatments that a lot of doctors are using? And you can jump on the FLCCC website, the frontline doctors, and they're out there doing this stuff, and they're reporting their data that they're seeing in the hospitals right now every single day on this website. And it's becoming more and more clear that these are viable, which we knew to begin with, that ivermectin was a viable option. But we had to get this vaccine pushed for some reason. And now we're saying that natural immunity doesn't exist. There's actually, I found in the British Medical Journal, one of the articles I found this morning, it was titled, "Why Doesn't Natural Immunity Exist in the United States?" just in the United States, right? Because other countries are observing natural immunity and they're finding that it's actually more effective than the vaccine in some of these studies, right? So the Cleveland Clinic did a study. I found this one this morning too. The Cleveland Clinic did a study. They looked at their 50,000 workers, right? They had 50,000 employees. They had 1,300 that were unvaccinated and had contracted the virus earlier. Okay, so they fit into that category of just true natural immunity. Looking when you study and you break up into groups, that was the group, and there was 1,300 of them. They ran this study for 5 months testing these people. Not one person tested positive in 5 months out of those 1,300 people. Okay, that shows natural immunity. That was much better rate, right? A 0% reinfection rate than the 45% reinfection rate found amongst the vaccinated people. So it shows that natural immunity, again, is better. I found a study out of Tel Aviv, and we use a lot of the Israeli studies right now because they were the first country to really become highly vaccinated. They reached 78% vaccination rate, I want to say, very, very quickly, much quicker than any other country. And right now, they have the highest infection rate they've had ever since COVID started, even pre-vaccine. So they started looking at this, right? And they call them breakthrough cases. Well, the problem with this is they're not breakthrough cases. These are Delta virus cases, okay? And Pfizer and Moderna themselves have said, we never studied the vaccines against the Delta variant. So basically, we're throwing this vaccine around for the Delta variant. Why wouldn't we study it? We are in a pandemic of the Delta variant at this point. It just seems bizarre to me that we know we haven't studied that, and we're not even releasing the data that we do have on what was studied, right? The FDA just asked for a 55-year lockdown on their information where they release like 100 pages at a time over the years of the studies that were done to approve the emergency use authorization. That just seems crazy to me. Why can we not see these studies? And it's not me asking for, well, I am now too, now that I know that, right? But there's researchers at all of our universities around that have been going to the FDA. Hey, can we see these studies? We want more information on the vaccine. They're trying to make educated decisions for themselves, but for some reason, we're not releasing it. So I don't know what's there. I don't know what's not there. And I'm not here to speculate, but what I am here to do is point out that our immune systems help keep us healthy, right? They defend against things like this. And the more that we can support our immune systems, the better results we're going to see as individuals just being healthy and living a healthy lifestyle. So I talk to you guys constantly about getting to homeostasis and trying to maintain that level of homeostasis. And it's highly important. We've got to support our immune systems with the things that I talk about on all these other 12 minutes to health when I talk about exercise, right? Kaiser Permanente just did a study with I think they have 48,000 employees, and they showed that just exercise, right? The 30-minute walk per day, they said 150 to 180 minutes of exercise, moderate exercise like I talk about a week. That's a walk for 30 minutes a day, 5 to 7 times a week, or 6 times a week, to get that exercise in. They showed that reduced, I think the number was half. Like you're half as likely to contract COVID and have symptoms if you just exercise. And that was, outside of a vaccine or a medication or anything else. And I tell people all the time, right? You cannot outperform walking when it comes to medicine and your health. There is nothing that will replace that for you. And you have to have the exercise for yourself in order to be healthy. And it's just incredible. And the vitamin D that I always talk about, the essential fatty acids, the omega-3s, and the support that they give to your immune system and your cells and your ability to maintain that level of homeostasis is just unmatched. And you've got to support yourself with this stuff. Being overweight is deadly to us when it comes to COVID. We're the most vulnerable people, those that are overweight, and it's just that doesn't matter if you have a vaccine or not. They've shown that being overweight is still a major risk factor, right? So as we sit around and wait for more and more data to come out, we've got to look at these things objectively, and we've got to look at what's really going on. One of the best instances outside of Israel, right, where we have good studies coming out of there, they're not complete yet, but they're coming and they're getting better. And because they were so quickly vaccinated, we're starting to see, what does that mean for the country and their health overall. But one of the best things that's happened is, and it was unintentional, but it was a stress study, right? And a stress study is when you have something like, say, a vaccine, and you vaccinate this group, and then you introduce the virus that you vaccinated against, and you see the response to it, right? Well, this happened in Canada. And it happened at the places that have been most vulnerable to COVID in the care facilities, the old folks' homes, essentially, right? Where the senior citizens are living and being taken care of. Well, they had an outbreak in 23 of these clinics across Canada, and this was in August and September, so here recently. In these groups, 100% of the patients were vaccinated against COVID-19. And they're still in the high risk areas, right? They're older, they have different diseases and things like that, the comorbidities, but that's why they've been so vulnerable the whole time. The thought was the vaccine would help take care of that. 98% of the staff throughout these facilities were vaccinated, okay? So this is a great study. We've got everybody being vaccinated, and we're gonna introduce this virus. So what happened in all these different places? And again, this wasn't a study that they ran. This was unintentional. This just naturally happened. And they found out that the infection rate remained the same. The death rate remained the same against all these vaccinated people. So there was no change to pre-vaccine COVID throughout these long-term care facilities. And that's a big deal. That is like I said, that is a design stress study in some settings, right? That just kind of occurred and happened naturally here. But what it tells us is that we've got to do more research. And more importantly, what it tells us is that despite all the research, despite all the dogma, despite all the misinformation that's out there, we've got to remain healthy, because our immune system is the number one thing that's going to protect us throughout the rest of this pandemic, throughout COVID-19, throughout the next virus that comes around, throughout the next flu season that comes around, right? Our vitamin D levels are crucial. Our exercise amount is crucial. Our stress and how we're managing our stress is crucial. We've got to do the right things for ourselves to give ourselves the best chance. So I know there's a lot of information out there. I know there's studies, there's papers, there's articles on both sides of this argument, vaccine, natural immunity. But the one place that it always comes back to that has been right from the beginning is our ability to remain healthy and support our own immune system through the way that we are moving and exercising, through what we're eating, and through how we're managing our stress. And that's not going to change. That'll never change. And that's why I dig into that research, because it has proven the test of time, and it will continue to prove that test, because it's what our bodies need to get and stay at homeostasis. So I know there's a lot of information out there, guys. Hit me up, give me a call up to the office, email us, text us, whatever it is. If you have more questions on this, if you want more information on this stuff, I'll continue doing my talks, but get a hold of us and find some answers for yourself. And if you're suffering with something, if you're not as healthy as you'd like to be, if you have some pain, back pain, neck pain, headaches, all the stuff that we take care of in the clinics, then give us a call. We always have our $39 offer for you guys to come in. That $39 goes to our local monthly charity, and it covers your consultation, most importantly, and your health risk assessment to see how healthy you are and get your health score and see what's causing these issues that you're having. And we'll take x-rays if we need to, and we'll go over everything with you. So, $39, there's really no excuses to not come in and not start to be healthy and live a healthier lifestyle. So get a hold of us, guys, and as always, I appreciate it, and I'll see you next time for our 12 Minutes to Health. Thanks.